My name is Justin Juvenile. I'm the Communications Director for the Future of Music Coalition. We're starting today with Alex Maiolo, who runs our HINT program, which is a unique hotline that allows musicians to call up and get health insurance advice from other musicians. So we're going to start with Alex giving us a little background on how artists can log onto our website to get a HINT appointment. So Alex, why don't you fill us in on how that works?
It's actually really simple. You go to our website at futureofmusic.org, and right there on the opening page, you'll see a link to the HINT page. Click on that. There are a few questions that we need to get out of the way, a few ground rules that we kind of put in place, and we let you know when we're available to speak to you. Set up an appointment, and then we call you. A half-hour slot available, and we're all yours for that 30 minutes.
So how much does the HINT program cost to enroll in?
It doesn't cost anything at all. In fact, the phone calls is on our dime.
Does Future of Music Coalition sell health insurance or make any kind of profit off of the HINT program?
No, we're not selling health insurance. In fact, we want to make it clear that we have nothing for sale, and all that we're doing is offering free and very valuable, I might add, advice.
So if you're an average indie artist who's scraping by, how much does it cost to get health insurance, and how hard is it to get health insurance?
Well, it varies pretty wildly from state to state. Some states it's easier to get health insurance than others. We have we have information on how health insurance works in all 50 states, and we can also point the musician to resources so they can educate themselves further about the rules and laws of their particular state. Generally, what we do is give what is pretty solid general advice regardless of the state the musician is in. Oftentimes, they'll go off and do some homework, and we'll set up a second call. Once they get more educated, they may have more questions on the subject, and we're happy to schedule another appointment.
So can you give us a sense of what someone who is getting a basic health insurance plan might be paying?
Sure. Again, it kind of varies as to what's available in each state, but we regularly ask. I mean, one of the questions that we ask is, how much money do you have to spend on this per month? Does your employer offer, your full-time employer, have any options for you? Sometimes it's as simple as saying, if you pick up 2 or 3 more hours at work a week, this will be free. In the other direction, we may offer some kind of bare bones, minimum emergency only inexpensive thing like a short-term plan if it's offered in the state.
So what are the qualifications that the people have on the HINT phone line to give advice on health insurance?
Well, I'm one of the people who handles the phone calls, and the other person is Chris Stevenson. Chris and I are both in insurance by day, primarily property and casualty, but we understand health insurance really, really well. And we're both active musicians. I play in 2 bands, and Chris plays in a band himself.
You guys actually know what it's like to be struggling musicians.
Oh, absolutely. I mean, we've been there. We've been uninsured musicians, so we understand the plight.
Give us some examples of musicians that have been helped by the HINT program.
Sure. I can give you 2 different examples of how I feel HINT has worked positively. One, a pretty famous musician from the West Coast called into the line and had a bunch of questions about whether the program he was already involved in, the health insurance policy that he already had in place. He had questions about it and didn't understand it and didn't know if it was actually a good policy. And by explaining to him what he already had, I think he saw that he was getting a lot more for his money than he thought he was getting. I explained to him that he was already free to go get checkups, to focus on his wellness and to get his prescription drugs paid for. He didn't even know he had that. He was paying for it already, and we explained to him, what he already had in place. On the opposite end of that spectrum, we had somebody call in, another relatively well-known musician who, like a lot of musicians, doesn't make a lot of money from his craft. And his budget per month was $40 to $50, which that's a pretty low budget. But we, in his state, short-term health insurance plans were available, and we explained to him how they worked and how, even though they were fairly stripped down, they did put in place the safety nets that most health insurance policies would offer, and it turned out to be about $43 a month.
When musicians get sick, oftentimes you see bands or friends of the band staging benefit concerts for them. How do you think that works out in terms of paying off health care costs?
Generally, I think that what you see there is a lot of goodwill that doesn't generate that much help. I mean, when somebody's stuck with a $75,000 insurance bill and all of their friends get together and raise a couple $1,000s, I mean, it's really just a drop in the bucket. I'm sure, I mean, from a psychological standpoint, I mean, who wouldn't be touched by their friends gathering and giving and donating their time and their money to help out their friend? But does it actually accomplish eliminating the $75,000 medical bills? Not really. What we would encourage people to do in cases like that is, well, kind of form coalitions locally, make a commitment for everybody to get health insurance, perhaps with a higher deductible. So the premiums would be lower per month, and even if the $5,000 deductible or whatever they choose seems like an amount that would be too high to pay out of pocket themselves, it's a heck of a lot easier to have a benefit concert to raise $5,000 to meet the unfortunate artist's deductible than it is to try to come up with $100,000.
Do you have any general tips for musicians about getting health insurance?
Sure. Well, I think the best thing you could do is to get educated about the rules, regulations, and laws in your state. The best way to do that would be through the Access to Health Insurance Resources for Care website, which is put up by the Actors Fund. The acronym of that is AHIRC, or AHIRC.org. The rules, laws, and regulations for all 50 states are available there, and I would encourage anybody to go and read up on what's available in their state. Another thing you could do, obviously, as far as getting health insurance is concerned, is just ask your employer. Larger companies in particular offer health insurance to their employees. Sometimes it's as simple as just picking up a few extra hours at work or changing your status. And rather than going out and buying an insurance policy, which may cost you between $100 and $200 a month, you may just be able to pick up a few extra hours at your job and get this taken care of for free, as well as earning a little bit more income while you're at it.
So thanks for the really interesting discussion, Alex. I was wondering if you could finish by giving people the web address for the HINT program so they can find it.
Oh, absolutely. Go to www.futureofmusic.org, and on the front page right there, you'll see a link to the HINT page. Just click on that link, and that'll get you started, and before you know it, we'll be giving you a phone call.